Hey everyone, and welcome to a new Living Life Naturally podcast, where we are bringing you all things related to women in midlife and in perimenopause and menopause to help you live a better, healthier, and happier journey. So it's my delight today to have Donna White. She is a seasoned expert in bioidentical hormone replacement therapy with over 30 years of experience. So, as the founder of BHRT Training Academy, author of the Hormone Makeover, and a pioneer in establishing BHRT programs, she's played a pivotal role in advancing hormone health. Her expertise is augmented by her personal journey with hormonal imbalance, rendering her a compassionate authority in this field. So Donna's unique approach lies in her ability to translate complex medical information into digestible content, making her a sought-after speaker, educator, and consultant. So her training academy has revolutionized the way medical practitioners approach hormone therapy, leading to significant improvements in patient care and practice growth. So that's just something wonderful to hear. So thank you for joining us today, Donna. I'm excited to have you.
Oh, I'm delighted to be here. And I have to say, I'm a big fan of your mission. Thank you that you
Thank
are
you.
empowering women in our age range, might I say, so that they're fully aware and equipped that you can have a
Right,
fabulous life and feel really good despite our maturity.
right. And I kind of feel like people are missing out because menopause, perimenopause has a negative connotation. And I think if they flip the switch and realize that this can really be the start of a wonderful phase of life. I mean, let's face it, children are moving out the home. We're left either with a partner, without, however, your little family is set up. And it can be a new beginning. It can be a start of you following your passion and you learning these days how you can manage perimenopause and menopause, because years ago we were not that lucky in having so much information. So I really honor you, Donna, for having so much expertise in this area because it's so needed. There is so much misinformation out there.
There is, and thank you for bringing that to your audience and beyond. So I'm happy to be here. How can we help your audience today?
Well, just tell us briefly a little bit about your own journey, because that's been a really integrative part of your whole
Yes,
place that you've got to.
it's a vulnerable story, so I just have to let down
Mm,
my guard here and tell the truth. The real reason why I got into hormones and bioidentical hormones was my own mess. My mess is my message, you might say. So when in my mid 20s, I had a terrible, terrible case of PMS.
mm,
Once a month, I wanted to rip somebody's head off. I had awful periods and acne and hormonal headaches. I mean, all of those symptoms of PMS, I had them. And what I didn't want, Lynn, I didn't want to just take some medication or synthetic hormone just to get rid of the symptoms. Now, I'm not saying anything negative if somebody,
right.
that's what they've had to do to survive. I get it. But for me, I didn't want that. I wanted to figure out how can I fix this? What is wrong? And it didn't take me very long to realize, oh, this is hormones. This is hormones. And then I found out about bioidentical hormones and how to get hormones in back into balance. And that totally changed my life. So I conquered that PMS. I got through perimenopause with like a breeze, just easy. Even menopause, I didn't even have the first hot flash. And now I've been postmenopausal 10 years. I'll be 62 next week. So I know what it's like to have hormone imbalance, and I know what it's like to have balanced hormones. Let me just tell you, balanced is way better. And if I can do
Absolutely.
anything to help women get and enjoy that state, that's what I'm here
Mm.
for.
So really, there's been bad press, not really press, but bad information out there about even bioidentical hormones. We had people out there, oh yes, come on, and we'll compound some for you, and it just didn't work for some people. And it's really about getting somebody who really knows what they're talking about and really knows how to use those bioidentical hormones as they relate to each individual person. So how have you found that you have been able to help, especially women in perimenopause, because that's who we're addressing? How have you been able to help them find that balance?
Well, thank you for asking that. I think you brought up so many good points in those couple of statements there. And first of all, I think there's such confusion and misinformation.
Mhm.
And that's what I want to help overcome. And that confusion is really, well, there's a number of reasons why that's going on. But Lynn, the confusion is rampant about hormones. If you just bring up the word hormones, people think, oh, they cause breast cancer. Oh, hormones
Mm.
cause, heart disease. Why would I want to do that? But the truth is, there's different types of hormones. There are bioidentical versions, as you point out. There are synthetic versions, and there are animal-derived hormones. So, for the purposes of our conversation here, maybe we should be very clear about what bioidentical hormones are so that there isn't any confusion as to
Right.
what we're saying. So, bioidentical hormones are hormones that are exactly the same as the hormones our bodies make. There isn't a difference. So, these bioidentical versions have the same molecular structure. They're exactly the same. Your body can't tell the difference whether you rubbed on a cream or maybe had an estrogen patch, because they're the same. And they work in the body the same. There's a lot of research. We could talk about research later, but they're the same. So that's in comparison to, or contrast, non-bioidentical hormones are the synthetic versions. It's a different chemical molecule, and they just don't work in the body the same way. Or they're animal derived, like horse urine estrogen.
Mhm.
So those are different types of hormones, and they don't work in the hormone receptors the same way. They have side effects. So that's one part of the piece of the information that everybody needs to be clear about. Bioidentical hormones aren't similar to human hormones. They're exactly the same. So that's the foundation that we need to keep in mind. But the frustrating part is, unfortunately, there is so much confusion about hormones and their safety and the research. And it's created what I call a hormone crisis. Women are confused. They're torn
Yes.
between two opposing viewpoints. Oh, hormones cause cancer. My gynae, said don't use them. You're going to give yourself breast cancer. They're torn, but they're symptomatic. So what do? They come and learn from people like Lynn Wadsworth. That's a source of frustration for me, and I really want to help clear that up as much
Mm.
as we can, because there's 75 million women in the United States that
Wow.
are, that are in perimenopause and menopause, and they need to know what to do. But here's what's really sad. 75% of the women that go to their gynecologist or their medical practitioner to get help with perimenopause and menopause walk away untreated.
Mm.
And so things need to change. They need to change. So,
And how would one know how to go to a doctor and find out if they're using the real bioidentical hormones?
or would we say if they
Or
need them, or how do you know? And
right.
yes, thank you for bringing that up, because a lot of women are not aware, and practitioners for that matter, are not aware that so many symptoms are actually correlated with hormone imbalance. Okay, so we all know that hot flashes or vaginal dryness, okay, yeah, that's in PMS, or, we that comes to mind. Oh, that's hormonal. But some women don't realize that fatigue is one of the main symptoms of hormone imbalance. And like being tired in the afternoon, or just tired all day long, or sleep, can't get to sleep, can't stay asleep, or get to sleep okay and then wake up. So it's fatigue, it's sleep, it's mood issues can be correlated with hormone imbalance, like anxiety or just depression, or mood swings, angry one minute, crying the next. So mood issues are correlated with hormone imbalance. So it's memory. Can't remember what you went to the pantry for, or the paragraph you just read. And then weight gain. That's so many women struggle to maintain their waistline when they, reach perimenopause. And they don't realize that if hormones are out of balance, you can be doing everything right and exercising and dieting, all the right things, but you won't get the results of your effort if there's hormone imbalance. And Lynn, the average weight gain for women in menopause is 20 pounds.
Yeah.
It shouldn't have to be that way. And
Right.
we don't like that. And then, there's wrinkles. Women with low estrogen look 7 years older than women with normal estrogen, and we lose 30% of our collagen in menopause. So all these symptoms, and there's many, many more, can give you an indication that your hormones are out of balance. But to directly answer your question, it does come down to testing to know for sure. We need to have our hormones properly tested
Properly.
and
Yes.
properly interpreted to really know for sure. And you have to run all the right hormone tests. So there's some nuances there,
Yeah.
but it is easy to find out for sure. Yes, it's hormones, or no, it's not hormones.
So what is the best testing
Ah,
that you like to use?
that is a great question. And it's a confusing question, even amongst medical providers. There's 4 ways to test hormones. There's saliva testing, there's dried urine testing, also called Dutch testing. There's serum testing, which is the normal blood draw from your arm that you go get. And then there's capillary blood spot. That's like a little finger prick test. So those are the four ways to test hormones. Now, there's benefits and limitations to each type of hormone testing. And it depends on if you're already on hormones, like a patch or a progesterone pill or a cream or whatever. It depends on what type of hormones as to which best test. So to start out, let's just make this simple. So let's say somebody's listening and they've got these symptoms. They really want to know if they're not taking anything. The easiest way is to get everything tested through blood testing, except there's one caveat. Let me come back to that. So a doctor can order all of the right thyroid levels, and there's several things that need to be checked. They can order the estradiol, which is the primary estrogen, progesterone, testosterone, DHEA. They can order the FSH, which is follicle stimulating hormone, which gives us an idea what's going on as to whether or not we are actually in menopause, and is our tissue getting enough hormone levels. There's a few, vitamin D. There's a few other tests that we recommend. So you can get a lot of information from serum. However, there's one hormone that has to be tested another way, and that's cortisol. Cortisol is we call it the stress hormone, because when we're under stress, it goes up, and it's supposed to, but the problem is when it's elevated day after day after day, and sometimes it becomes too low or it bounces all over the place, cortisol levels So important to test because it will interfere with every other hormone. Even if we have enough estrogen or thyroid or insulin, if cortisol, if we have too much stress hormones, it blocks them from working in our body. So we want to know what our stress hormone level is. And high cortisol, pretty much everybody's heard of it now. It triggers weight gain. That's a hormone, one of the hormones that causes abdominal weight gain. There's a lot of cortisol receptors in the abdomen. So to check cortisol, remember, it's critically important to check cortisol levels. You have to check it 4 times a day. Nobody wants to go to the lab to get blood drawn 4 times a day. And plus, if somebody brings a needle at you, your cortisol might go up a little bit, right? Some of us don't love needles. So it has to be done in dried urine, which is a little strip that you pee on, or saliva. So it needs to be checked morning, noon, evening, and night. So to start out, let me just circle back and clean all that up. If you're not taking anything, you can get a whole lot of information that you need from your standard serum testing, blood draw, as long as you do all of the right levels, and then have your cortisol checked. It can give you all the information you need to get started and to get to the bottom of your symptoms.
So I'm going to go a little bit off track here. So what about postmenopausal women? Are they
Mm.
still supposed to be checking their hormone levels and doing something to keep them healthy in that regard?
Oh, I love this question because it's one of the myths and misconceptions about hormones that women have. Some women think, oh, I'm too young to have hormone problems because I'm not in menopause. I don't have any hot flashes. But it's sad. So many our younger women have PMS and
Yeah.
PCOS, which is polycystic ovarian
Hmm.
syndrome. And so they're having hormonal problems or awful endometriosis or.
Mm.
So you aren't too young to have hormone problems, nor too old. So the mature women will say, oh, I'm past all of that. I had menopause 10, 15 years ago. Well, in either scenario, that doesn't necessarily mean your hormones are at optimal levels to protect your health. Because think about this, as hormones decrease, the diseases associated with aging increase. So it's still very important to know what you're dealing with as far as your hormone levels because hormones are protective. Some women, maybe in their 70s, maybe they're 72, they still have symptoms or they're just tired or they don't sleep well
Mhm.
or they're losing bone or they're concerned about cardiovascular disease. So it's so important if you think about what hormones actually do in the body and how protective they are and listen, thinking in terms of research, at any age, we want optimal hormone levels to protect us because hormones, actually, women on hormone replacement, now I'm talking about the bioidentical forms, women on hormone replacement therapy live longer. We know that from research. We know that they have less heart disease. And isn't that the number one killer of women? So women on hormones live longer, they have less heart disease. And right now I'm speaking to research. I'm not just saying things. I'm saying, what does the research show? Research shows that women on hormones have less risk of osteoporosis and bone fractures. They have less risk of cognitive decline and Alzheimer's, verified in research. And they have better quality of life, meaning they sleep better, they have better sexual function, better mood, and better skin. We wrinkle slower with optimal hormones, less weight gain, and less diseases. So it's never too late to have a look-see at what your hormone levels are.
And would they go for the same type of testing at that
Yes,
age? Yes.
yes, Lynn, yes.
Yeah, very helpful, Donna. So is there a way, because this is something I've heard. So you're on bioidentical hormones, but do you know that you're getting the right amounts of
Mm.
each?
That is a great question. And you need to know. I hope none of our listeners ever just go get put on hormones and are never monitored properly. That is just not the way to do it. So, no, here's how it typically goes. It typically goes that you go see a practitioner that is well trained in hormone balancing protocols and bioidentical hormones. They first of all test because you don't ever guess. Not all women need estrogen. Not all women need testosterone. Some do, not all do. So to identifying, be tested, identify what's going wrong, and work with the ladies as on their symptoms because so much this is one of the things we have a mentorship team at our training academy that helps other doctors learn, and one of the things they say is treat the patient, not the paper, meaning the lab paper. You have to look at the patient's symptoms and help her. Yes, you look at the labs, but you combine that with her symptoms and what she is concerned about. Maybe she's more concerned about hot flashes than she is a wrinkle or two, whatever the situation is. So you want a very customized treatment plan that you've joined with that practitioner to help come up with a treatment plan that you're after and is applicable to whatever it is you're dealing with and your hormone levels. And then to your point, be monitored. So once you start your treatment protocol, maybe there's supplements involved, maybe there's a prescription for a hormone or two and some dietary changes and lifestyle changes, then absolutely those levels need to be rechecked anywhere from 6 weeks to 3 months, depending on what you're, having replaced. And then a couple times a year. Once you get your hormone levels balanced, you still need to be taken care of and checked on about every 6 months. So that's really important. It's not just a one and done
Mm,
scenario.
mm. Yeah, I appreciate that. Um, so you did mention women that have PCOS,
Mhm.
and do you find that that decreases as they reach the menopausal stage or not?
Great question. Yes, to a certain degree, because let's think about the hormonal milieu that typically occurs with these PCOS patients. And you don't have to have cysts to have PCOS-like syndrome. So here's what that entails. Many of those women make too much androgens, such as
Mm,
testosterone and DHEA, which is one of our adrenal hormones. And those, when the levels of testosterone or these androgens are higher in the body, well, the first question is, why are they higher? But the next point is that affects what's going on in the ovaries. So these women don't ovulate regularly. And it's sad that so many of them are, deal with infertility, and it can be addressed. So you've got a lack of ovulation, which means a lack of progesterone, which does, then you don't have enough progesterone to balance out your estrogen. There's also some genetic components that we're just learning about PCOS, where these women are, they have the inability to convert their testosterone into estrogen. So there's a whole lot of factors going on. And sometimes they have thyroid issue, and most of them have insulin resistance. So circling back to, well, why would these women be making too much testosterone? Usually it's because of this genetic issue that's blocking their conversion of testosterone to estrogen, and or it's driven by insulin and insulin resistance. It just goes hand in hand. Now, that might sound complex and complicated. It's like, oh my God, what do I do? There's hope. All of this, if you measure it and assess it and get some targeted help, these women do fabulous and feel so much better,
mm.
and can have the opportunity to have children in many cases. So then as they age, I'm sorry, I'm taking the long
That's
road
okay.
to answer your question. Yes, some of the hormone levels do decline. Like they don't make as much hormones like the rest of us as we approach menopause. So sometimes symptoms may decrease, but unless you're looking after the underlying causative factors, I mean, there's just a better quality of life and a healthier version if you're managing and addressing these types of hormone imbalance. And it's tricky a little bit. So let's say the lady's perimenopausal and she's 50 and her testosterone has now dropped to low levels and she's symptomatic. Because, we need testosterone. Actually, testosterone helps prevent breast cancer, maybe as much as 40%. So let's say all her life she made way too much testosterone, but now she's 50 and her testosterone is negligible. And, maybe estrogen is starting to fluctuate and progesterone is low. So would you want to give her testosterone when she used to make too much and she had acne and facial hair and she's like, I don't want to do that again? Of course not. Well, there are ways, knowing that history, meaning knowing your patient, having the conversation with her and understanding all that, there are ways around it. There are ways to help bring that testosterone level to a good normal range, slowly with lower levels or with certain nutrients that help or supplements that help guide it down the right pathway so she doesn't end up having acne or facial hair. So there's a lot of nuances, but the bottom line is nobody has to suffer with hormone symptoms or deficiencies which set them up for diseases associated with aging. So there's always good news here.
Yeah, that is good news. I think that women who have reached this phase of life, I like to call it the season of life. This is one of the seasons that we go through. And I just think it can be a positive thing. So I know I often bring up people I know going and getting a blood test. And of course, then it depends on the time of month that you get a blood test as to how the hormones play out. And a lot of time it does go back to the symptoms. So a doctor can tell you, you are not in menopause or perimenopause, but you have all these symptoms. And that's what you're talking about, getting to know your patient. You really have to take the time to sit and talk to them and find out what's going on.
Yes, and that brings up something very important, Lynn, is that doesn't typically happen in your average visit to your gynecologist or your family practice because they just don't have the time. I mean, they're in, most of the managed care practices, they really only have about 15 minutes with the patient. So it's not their fault. They just are not allowed the luxury of that kind of time. That is why many aspects of functional medicine or integrative medicine it's mostly cash practice, cash pay out of pocket, because that's the only way these providers can give their patients an hour's worth of time and really hone in on what they need. And I'm sorry, that's just the way it is in our country. It's the way we're set up. But if you think about it, it's an investment you are making in your health and your long-term, your longevity.
Yeah, and I think our longevity is something that is so important to us, Donna, and I'm sure you agree. Years ago, people would reach that 72 and that would be it. But now we've got people living into their 90s, and who wants to be on a walker or not healthy all those years?
You are so right. We live a third of our life post menopause, and we want to feel strong and look our best and feel best for ourselves, but for those people that are in our lives that I want to know who my kids are when I'm 90. I want to remember their names. I don't want them to take care of me. Like you said, I love this season not having periods, and my kids are grown, and I'm getting to have fun now.
Right. That's exactly how I feel about it. It can be a very fun and adventurous time of life. Yeah.
Lynn, I think it would be a disservice if we didn't tell your audience one thing, because a big concern is breast cancer. Can we just speak to that for a minute?
Yes, of course.
I'm saying that so many women are like, oh, this sounds great, but my mom had breast cancer and my three sisters and this and that, so I can't take hormones. Or, who wants to do something that puts you at risk for
Right.
breast cancer? So I'd like to just speak to those women and women in general in terms of hormones and how do they cause breast cancer or not? Well, what research shows, and believe me, we have to stay on top of the research at my academy, and it's very critical for us to do so. So, what the research shows is that estrogen, it's been thought, for a couple since 2002 to cause breast cancer. But is that correct? No, that is not what the data says. Research shows, not just one study, study after study now shows us that estrogen actually prevents cancer. 23% reduction in breast cancer in one paper, another paper, 33% reduction in risk of breast cancer. There's a slew of research studies showing the same thing, that estrogen doesn't cause breast cancer. It's actually protective and preventive. And let me take that one step further. One paper found that, and not just one, other studies have shown that if women are on hormones, on estrogen, and then they get breast cancer, there's a 44% less risk of death from breast cancer if they were taking estrogen. So it's protective. And the progesterone and testosterone are very breast protective. We know progesterone is one of the most powerful anti-breast cancer substances that there is. There was a study way back in 1981, the year I graduated from high school, done by Johns Hopkins, that found that half of all breast cancer, Lynn, could be prevented by having a normal level of progesterone. Since 1981, that's been a minute, there have been so many other studies that have shown us how progesterone is protective in the different ways and how it offsets estrogen and so forth. And now we even know that testosterone may even help prevent breast cancer as much as 40%.
Wow.
Hormones really aren't scary. We just need to get to the root of what the research says and learn about them. Providers need to learn. Women need to hear this information so that they can make informed choices themselves. So thank you for letting me run off and talk about breast cancer, because it's a scary thing.
It
And
is.
just because there's family history of breast cancer doesn't that's not a contraindication for a woman to receive bioidentical hormones. Now, that is a case-by-case decision, and there's a lot of nuances and protective things that can be done. But if a woman currently has breast cancer, no, that's not going to happen. Nobody's going to do that. And then there's a lot of variation in opinions as to whether, if a woman had breast cancer in the past, does that eliminate her from using hormones? There's a lot of answers to that. What the research shows is it doesn't increase their risk for, getting breast cancer again, but that's a real complicated topic.
So where would one go, or where would one start looking to find a practitioner who could help us through? Because we all know our doctors don't have the experience that they need. Now, coming out of your academy, they come out of it with that knowledge that they need. So how would we even find somebody? What should we be looking for?
Yes, let's talk about that. So yes, you can find some providers on our BHRT Training Academy.com website. There's a directory there, but let's say there's nobody in your area. One of the things that you can do, first, let me say, it's not our medical providers' fault that they don't know hormone balance. They're just all in medical school. They're not. Gynecologists are surgeons, so they're just not taught. And for them to learn it, they have to step out of their box and go get their own training, which many do. I'm so excited. So you wouldn't believe it, Lynn. So many medical providers now really want to learn And we've been inundated with gynecologists contacting us lately. They want to learn. I'm so excited
That
about
is
that.
exciting.
So,
Yeah.
but let's say you don't have anybody. One of the things that you can do is you can Google bioidentical hormone replacement therapy in your area, and then start looking at their websites, maybe even call them up, have a conversation. How long have they been doing bioidentical hormones? And here's some more real important questions. Okay, so how long have they been doing bioidentical hormones? And do they do all dosing forms? Sadly, some practices only do hormone pellets. I love hormone pellets, but it's not right for every woman. So you don't want to go to a medical provider that only knows one way, that only does pellets. No, you want somebody well versed in, creams and patches and pellets and, all the different things. And you want a medical provider that tests all the hormones. You see, it's real important. You can't just look at estrogen, progesterone, and testosterone. You want that medical provider. So ask the questions. Do you check all the hormones? Do you check the adrenals? Well, we talked about how important cortisol. Do you check sex hormones? Do you check the adrenal hormones? Do you check thyroid? Do you check all of these things when you're working with me as a patient? So find out how long, what kind of hormones they do, and what type of testing they do. So don't just pick a number and go see them. Do some homework. And here's another tip for you. In most cities, there are compounding pharmacists, and they know who's prescribing. That can help you find some. You can also go on some of the lab testing websites, and they know who's prescribing and ordering hormone testing, such as, saliva testing labs. They'll usually have a directory. So does dry urine testing labs. They usually have directories. So you have to do a little bit of homework, need to make some phone calls, and then decide and have a discovery phone call with one of these practitioners. If that doesn't resonate with you, find somebody else.
That's great advice, Donna. It's a very, very complicated issue. Yes, it really is. And one that here in the US, and I would hazard a guess, many places throughout the world, they still are battling the same things.
You are
So, yeah.
absolutely right. We have 5 different countries coming to us for training.
Mm,
And there are a number of countries in Europe that actually they pay for their menopausal women to get hormone replacement because they know they have socialized medicine and they pay
right.
for it because they want their women helped. So hopefully we see those kind of changes with some of the new legislation that is being presented.
Being British myself and having grown up in the NHS, yes, the more that you can get people learning over there, and I know there are more and more because I've talked to some of the British podcasters I've been on with, and asked them how it is over there, and it's the same thing. The wheels are turning slowly, but they are turning.
Yes, they are. And, with podcasts like yours, you're helping drive that movement. So my hat's off to you.
Thanks. I appreciate that. So where is the best place for people to find you, Donna?
Well, my book is The Hormone Makeover. So there's a website called The Hormone Makeover. There's some articles there. There's a free workbook. There's some things there. And, of course, the book is online. And to help find medical providers, my BHRT Training Academy.com website is where our directory is.
That's awesome. So I'll put all of that in the show notes for all of our ladies listening out there. You've just given us invaluable information, and I do so appreciate it, Donna. Thank you so much.
It's been an honor, Lynn. Thank you, and good day, everyone.
Thanks. Bye for now. You have been listening to the Living Life Naturally podcast, where we're on a mission to inform, inspire, and encourage women to live their best life confidently, joyfully, and freely from what's been holding them back. For show notes and free resources, visit holistic-healthandwellness.com. And I'd be delighted if you'd follow us on socials to connect further. If you enjoyed this show, why not share it with your friends? If you found good value, chances are they will too. And of course, a 5-star review on iTunes is always greatly appreciated, as much as I appreciate you listening. So until next time, live life naturally and joyfully.